Bolton Community and Voluntary Services is really proud to be part of the Community Asset Navigator programme for Bolton. This is a big part of social prescribing in Bolton, and it's about supporting people to access the fantastic things that are on offer in the voluntary and community sector. And it's part of doing things differently through the locality plan and looking how we can focus on prevention. The real strengths lie with our partners, Bolton Wanderers, which is the theme around physical activity, Band, building a new direction around emotional health and wellbeing, Age UK Bolton, working with older people, Bolton Lads and Girls Club around children and young people and families, and the Octagon Theatre around social inclusion.
The Bolton Wanderers Community Trust is a charitable organisation that aims to promote the health and well-being of the general population in Bolton. It aims to do this in 4 key areas. It's inclusion, disability, health and education. In many ways I see our role as being a catalyst for the individual and essentially helping them take their first steps.
I'm seconded to Bolton CVS from Band, also known as Building a New Direction. They are a mental health charity working with vulnerable adults in the borough of Bolton. Working as a community asset navigator allows me to go out into Bolton and the community to find different assets that are out there for our referred people and understanding the amazing amount of resources that is out there.
Social prescribing is an innovative way of working. When doctors reach for the prescription pad, most patients expect to receive a jar of pills or a bottle of ointment. Few think they will be referred to a gym, a volunteering scheme, or refer them to a Community Asset Navigator programme.
If you're from Bolton, you will have heard from Bolton Lads and Girls Club. We're predominantly what people think is a youth club working with 8 to 21 year olds, but we do so much more on lots of different projects. The Community Asset Navigators, my role is predominantly to work with young people, but I will be working with all age groups. We're there to get people more active if they've got any kind of illnesses, sort of low level isolation, things like that, get people back out into the community, joining groups and maybe volunteering themselves.
When the theatre was first built, the local people paid for it. They bought bricks to build the theatre. So it's always belonged to the people of Bolton, and it's always had part of its mission to serve all the different communities. And obviously as the community of Bolton changes, the work we do changes as well. So that's one of the reasons why the Octagon itself wanted to work with CVS, wanted to work with the CANS programme to connect activities in a different way to people accessing health services and statutory services.
At Headspace, all we wanted was to be seen as an arts organisation. We had a lot of barriers. We were a mental health organisation. We weren't given insurance in places. We were told that we had to have carers with us at all times. The Octagon was a place that saw us as artists.
As a Community Asset Navigator, we try to help the diverse community of Bolton to better their lives and promote well-being. We provide a person-centred approach, individually and tailored to each person we see. We focus on strengths, skills and passions and signpost to opportunities that will fully utilise them.
So I think that being able to take some of the weight off the health service is something that really appealed to me in the role, and the fact that you can make a difference to an individual is certainly something that inspired me to become a community asset navigator.
So we receive our referrals from all kinds of places, GPs, healthcare professionals, schools, youth clubs, self-referrals, anybody that needs any help, that's what we're here to do. I have a great viewpoint that the children and the young people of Bolton are our future, and if we can get them involved in the community and get them to become volunteers, that's what makes Bolton great.
From kind of working at Headspace and seeing all that's come down from Breakdown, it's about removing those barriers to access.
Proof that age is no barrier and that far from being a burden, older people are a tremendous asset to their local communities.
I think that's really key, that what the work the Octagon does and the work that the CAN programme and CVS is trying to do is all about that emphasising the positive, that people can get labelled and get stuck with, you have this issue, you have this problem, you need this help to engage. Whereas what we want to do here at Theatre and through our work with CVS and on the CANS programme is say, well, what do you want to do? What's the positive? What's the good thing? How do we build you up again? So it's approaching these problems from every single angle and really focusing on the best for the individuals, the best for the groups and the best for Bolton, because it's a great town and it's got great people and great things happening, and we're just trying to connect everybody in a better way.